Good morning to you and to all those who tune in every day. Today we can say that we had no fatalities yesterday, something that makes us feel happy because every patient we lose is a source of pain for their families, for their friends, and health personnel. As of this date, 1,824 patients are admitted in our country's hospitals. 27 in surveillance, suspects 1,259, and 538 are admitted. 5,266 people are under observation by our primary healthcare system. To detect people with SARS-CoV-2 and COVID-19, 1,949 samples were processed yesterday. At the Pedro Curie Institute of Tropical Medicine, 721. At the Molecular Biology Laboratory of Villa Clara, 350. In Santiago de Cuba, 281. In Havana, 280. At the Genetic Engineering and Biotechnology Center, 184, and in the Brothers Amihetas Hospital Laboratory, 133. As a result of the analysis of these 1,949 samples, 13 people tested positive. This represents 0.7% of the people studied. Hence, in our country, the cumulative total of cases studied stands at 65,509, and of them, 1,754 people have tested positive. At present, this represents 2.7% of the samples studied. Of the 13 cases confirmed yesterday, 6, that is 46.1%, were contacts of confirmed cases, bringing to 1,494 patients. This means that 87.2% of the people who have acquired the virus in our country, they have had a contact with a person previously diagnosed with COVID-19. Yesterday, in 6 cases, the source of infection could not be identified. And to date, the country accumulates 89 people whose source of infection remains unknown, that is 5.19%. Among the confirmed cases yesterday, 1 of them had a source of infection abroad. And now 130 people have had the same source of infection for a 7.4% of the confirmed cases. And people keep on asking me, Dr. Regina and other people have come to me, and they tell me, if no one is coming in, what people are we talking about? And yes, the problem is that the country is not open for tourism. But as I said earlier, I think that at a previous conference, Cubans who were abroad at the time that the airports and flights were closed, they are returning to our country. So in this case, yesterday's case, in the case of yesterday's case, has Mexico as a source of infection. Of the 13 cases diagnosed, 8 were female, that is 61.5%. In the accumulated total, there are 854 female cases, and that represents 48.7% of the total. Of the 13 cases diagnosed yesterday, 5 are male, that is 38.5%. However, in the accumulated behavior of the epidemic in our country, they are now 900 male patients, that is 51.3% are male. Of all cases reported yesterday, 9 were asymptomatic. And now we have 844 patients in this category. And this represents 48.1% of the cases diagnosed with the virus. This is something well known, and we have said that this highlights the need of protection, since these people carry the disease without any sign that would denote that that person has the condition. We also have to say that of the overall confirmed cases, 180 are children, and there were none yesterday, and of all those cases, 126 have already been discharged. As we have said, children's clinical evolution is much better than that of adult people. And none of the 180 children confirmed in our country have shown any complication whatsoever. Of the 13 cases confirmed yesterday, the age groups with more cases were those from 40 to 60 years of age, with 7 cases. That is 53.8%, followed by the group of people younger than 40 with 5, for a 38.4%. The provinces with the highest number of cases are Havana, with 9 cases, that is 69.2%, Matanzas with 2, and Ciego de Ávila and Pinar del Río with 1 case each. Of the 1,754 patients diagnosed with the disease, 530 have a stable clinical evolution. This represents 98.5% of the active cases in our country. As I have already explained, this estimate covers all diagnosed cases who remain admitted to our hospitals, excluding those who have been discharged, the people who have died, and the 2 evacuees. We have a cumulative total of 74 deaths, and this represents a lethality rate of 4.2%. When we compare our mortality rate with the region of the Americas, Cuba stands in the 13th place. The region has a lethality of 5.93%, and there are 12 countries with lethality rates higher than the average of 5.9%. Mexico has 10, Honduras 6.23, United States 6.02, Brazil 6.77, Canada 6.69, and a group of other countries whose lethality rate is above the average of the region, which is of 5.93%. We always mention the 2 foreigners who were evacuated at the beginning of the epidemic. And yesterday, 62 patients were discharged for a cumulative total of 1,140 people who have had the disease who have recovered, who are currently either quarantined or returning to their everyday lives. This represents 65% of the 1,754 patients who have tested positive in our country. Today we have to report 4 patients in critical condition, 1 less than yesterday, and 4 cases in serious condition and being treated, all of them in our intensive care units. And finally, we would like to inform you that yesterday, 79 travelers entered our country from the Dominican Republic and Suriname, and 45 travelers left, both Cubans who reside abroad and foreigners who work in our country. In this way, 10,782 visitors remain in Cuba, of which 6,524 are Cubans residing abroad and 4,258 are foreigners. This is figure similar to yesterday's, and as well as we have the 943 visitors who are staying in rental houses in the municipalities of Santiago de Cuba, Plaza, Centro Habana, and in Havana province. The world remains in turmoil with COVID-19. The disease remains in 184 countries with a total of 3,800,852 confirmed cases. Only in one day alone, 94,056 cases were diagnosed. And as I always say, what is even more striking, despite the time of evolution of this pandemic and despite the scientific efforts in search of effective treatments for this disease and so on, a total of 269,068 deaths have been accumulated. In one day alone, 5,780 people died in the world from this disease. That gives a lethality of 7.07%. The region of the Americas reports 1,644,817 confirmed cases, 49,380 in one day. That accounts for 43.2% of the total number of reported cases worldwide, and a cumulative of 97,602 deaths. That is 3,480 deaths in a single day. This, as I mentioned previously when we referred to the lethality in our country, that amounts to a 5.93% of lethality rate for the region of the Americas. And this is the information that we had to provide today.